KFSR and CMAC present the Central Valley Ledger, a public affairs program featuring stories from all over the Central Valley with Sevag Tateosian, 90.7 KFSR.
Welcome to the Central Valley Ledger. I'm your host, Sevag Tateosian. We are recording in downtown Fresno at the beautiful CMAC studios. This is part two of a two-part series with Assistant Director of the Fresno County Department of Public Health, David Luchini. Welcome to the program. Welcome back to the program.
Thanks for having me. Yeah, thank you for having me again. I wanted to make sure I wore the same outfit like our first interview, so there's some continuity in the interview.
Same here. We were, at the end of last show, we were talking a little bit about health and diabetes, so let's continue on that path. Tell us about diabetes.
So we were talking about that in Fresno County. There was a recent study that showed 49% of our population is pre-diabetes. And we kind of talked about the high-risk factors of weight, not being physically active, over 40, having a close relative who has a history or is positive type 2 diabetes, just a history of gestational diabetes, and being a man, all increase the risks of being pre-diabetes that could then lead to type 2 diabetes. So it's very important that we identify those factors and see if we're already pre-diabetes, because there are things we can do to change that around. There's a screening tool that only takes a minute to see if you're at a high risk of diabetes. It's on fresnodiabetes.org. So I ask people to just go on there, take it, fill it out, and then make sure you get an appointment with your provider and go over it.
Should we be scared? I mean, I know there are people who will not do it because they don't want to know the results.
There's a lot of people that way. And I can't say, I probably was guilty at one time of, oh, that's bad news and just going to put me in depression. But why would you want to avoid something so critical when you could learn something so important that you can reverse it? Do you want to wait till you get diagnosed as a diabetic, type 2 diabetic? Or would you prefer knowing that you're pre-diabetes and you could do something to reverse it? That's what you have to remind yourself.
There are a lot of people in desk jobs, and they'll say, well, I'm in a desk job, so there's no way that I can stretch or no way I can stay healthy. What do you have to say about that?
So you need to get up at least, especially if you're staring at a computer all day, you got to get up at least once an hour. Every 50 minutes, get up, stretch, take a couple of steps around the desk area, and then you can sit down again. But also, make sure on your breaks you're walking. Don't just sit during your break. You should take advantage of that 15-minute to walk. If you have a lunch, a half-hour lunch or an hour lunch, get some food in you. Once again, for the rest of your lunch, take a walk. I'm hoping there's some nice places you could walk around in wherever you work at. Those just the little things like that. Once again, we talked about in our last segment, if you can do 30 minutes of walking 4 to 5 times a week, 5 times a week would be better. You could split that, a 15-minute walk in the morning, 15-minute walk in the evening.
What I hear you say is you don't have to do much. I mean,
you do not
half
have to
hour
run a
a day, as busy as we are, which, we're all busy. We've got families, we've got jobs, we've got outside things after work that we deal with. But what I hear you say is pace yourself and do a little bit and it'll make a big difference.
Yeah, we don't want you, like I said, get up and start doing a marathon. You first got to do things safely. You got to build up your stamina and all that if you want to do longer types of exercises. But just start off with a nice brisk walk, 30 minutes, 5 times a week. That's where you start.
So I have a cousin and a brother that are big on stretching. Mm-hmm. And so when they always used to tell me, you need to stretch. And, they're like this where they get up in the morning and they stretch. And I used to laugh at them, believe it or not. I used to joke with them about it all the time. I used to tell them, don't forget your 5-minute stretch here and your 10-minute stretch there. But as I got older, I realized, they were giving me good advice, even though I was joking with them. How important is stretching?
Stretching is very important, especially like you said, the older you get. And if you're doing other activities, the more you stretch, it keeps you limber. It actually helps prevent injuries. So stretching it helps the circulation. That stretching helps your circulation. So it's really important. 5 to 10 minutes of stretching, I think, is very critical.
So do we have a big diabetes problem in the Fresno County?
We do have a big diabetes program. That's why we're talking about it. We need to do a better job. We know that in large parts of our county, it is difficult to access healthy foods. So the health department is working with a lot of community-based organizations, the school districts, to work at ways to get healthier fruits and vegetables to communities that are called food deserts.
I mean, when we were growing up as kids, whether it be my mom, my grandma, people would say, eat your fresh fruits, eat your vegetables, don't forget your vegetables. There's a seriousness to that, is there not?
Absolutely. The fruits and vegetables are critical to the health of our body. The recommendation is half our plate is supposed to be fruits and vegetables. That's the recommendation. Half of our plate should be fruits and vegetables.
So the Fresno County Health Department is involved in educating. I mean, it sounds like you have an arm of the organization that goes out and educates community members.
Yeah, and when we talk about the success of improving the overall health of Fresno County, that responsibility cannot just sit on one organization if we're going to be successful. And that's what's critical about that program I was talking about out of public health is they work with other partners because it takes a lot of partners to really change the culture of, once again, what did I say that last segment? How can we help our residents make the healthier decision every day?
I'm going to put you on the spot a little bit on this question.
How dare you put me on the spot?
Why should we care? Okay, so everybody has their own lives. We're all busy people. We've got families.
Why do you care so much about my health?
Why do we? Yeah. Why should we care about the health of other people?
Because when your population's unhealthy, it increases the cost overall for the community in healthcare costs. You've seen the cost of pharmaceuticals, especially in the last 3 years, have gone skyrocketing. The cost of healthcare has gone up, and we spend a lot of money on people who are sick. So it is an economic issue. The healthier we are as a population, the less money we need to spend on treatments and things like that to take care of our diseases. And the more you could put that money into other things, maybe stuff that you want to have more fun with, go to a restaurant, go to a park, an amusement park, wherever, you could put money on more of those fun things or investments, and less on taking care of all the treatments that you need when you're sick. So being proactive and making that healthier choice is not only good for you individually, but it helps you as a family member. It helps you as a community member overall. And the healthier we are as a population, that helps the business side, right? A business wants to have healthy people. If they have employees that are always sick because they're not taking good care of themselves, that has an impact.
Good.
Did I convince you?
Good answer, by the way. It sounded like I prepped you for that question. I did not. That was out of nowhere.
Because it's a very common question. Why do you care so much about me being healthy? Well, it does have an impact on everybody. It does.
Let's shift gears a little bit and talk about STD.
Can I?
Yeah.
One more. Hold on. Don't go.
All right.
Keep that STD question because
I'll keep the STD
that's
question.
just the adult side. The schools see that health starts even earlier. The health of a infant, toddler, and all that, because we know the healthier a child is before they enter kindergarten, the better they will do in school. So it's also to help kids succeed. If they're healthy, they're going to do better in school. They're not missing days in school. So that's why school districts are so interested in a healthier community. All right, now go.
Well, before I go there, now you're taking me on this direction. But it sounds like parents are important here. So
Yes.
so what role do you see parents playing here for their kids?
It's important parents to be good advocates of health. I mean, they can't just talk about it, they've got to show it. It's easy to say, you need to eat your fruits and vegetables,
when
kid,
the parent doesn't
and
eat
we're
it.
eating the junk food. You just can't do that. So, and for a lot of people, remember, the budgets are tight. So it's not so easy to get the healthier food because of a cost. And so that's why it's good for them to work with a lot of the community-based organizations that are looking at better ways to make sure it's more affordable to get these fruits and vegetables. So stay educated of what's going on in your community.
Speaking of community organizations, have you found that a lot of them care about this issue and bringing?
I have. In the last 5 years, I have really seen a turnaround in community organizations having a passion of it, trying to improve the health of this community. It has been great to see, in the last couple of years, there's creation of this Fresno FCHIP, Fresno County. Oh my gosh, I knew I was going to blank out. It's improvement in.
It's the bright lights
health.
in the studio.
No, even when I'm at work, I forget the dang acronym. But it's a committee that has not only the health department, but has Fresno State, the school districts, hospitals, federally qualified health centers. We have people from the private sector. I know I'm missing people, but I mean, it's just a well-rounded group of people working on different topics, be it diabetes, mental health issues. Department of Behavioral Health is doing a lot of great things going on in the community. And behavioral health has a lot of impact on physical health. That could be its own show. We'll get a guest from behavioral health to come on.
That would be an interesting topic.
But so they're working on topics like health literacy. There's a subcommittee out of this group that works on people understanding, what does health mean? You know, how do I utilize the health system correctly? We should be teaching a lot of topics on health at the elementary, middle school, and high school level. There's a lot of things we could be doing even better. So it's just this change in the last 5 years has been great. And so you're starting to see some great things happening.
It sounds like it's a change in the right direction. Now let's talk about the STD question that I was going to ask you earlier. Syphilis is the one that you hear about. Talk a little bit about STDs and then the major ones that we should be scared of or we're seeing a lot of in the county.
Well, we're never happy to see any STD. But when you say syphilis, and boy, syphilis has been around for hundreds of years. And you would think it's easily to treat, we would not be dealing with it. What's sad, in the last 5 years, we've seen a significant increase of syphilis. And the reason syphilis is so important to public health is not only the aspect of the adult and the impact of syphilis, but it's what happens to an infant. When you have a pregnant female who has syphilis and the baby's born with congenital syphilis.
I'm going to stop you right there. So mom has syphilis, that passes down to child?
If they're not treated. So we have women who are pregnant who maybe haven't gone in to see their provider, OBGYN, and maybe not be screened for syphilis or HIV, and then they show up to deliver and their baby's positive for congenital syphilis. Or sometimes, if they've never been screened, they may have a miscarriage, a stillborn baby, an infant with a major brain deformity. It's a significant disease. And so, you know, we're talking years. We're lucky to have one case. Not lucky. I mean, one case is not, it's too much.
But compared to other counties,
but
one
you know,
case
it's very
is good.
rare to see congenital syphilis. In the last year and a half, we've had 45 to 50 cases.
I'm gonna reiterate that real fast. So we go from one
maybe two
to 45 and
45.
50
That is a
cases.
major.
What's the reason?
Major issue.
I mean, what's going on that do you think that's causing this?
Well, as we have investigators, and we've even the Centers of Disease Control and the State Department of Public Health have come in to help us because the caseloads have gotten so large to do a really good investigation to get people treated. But we're finding that, it's young women, it's a heterosexual event, and we've seen a lot of history of these females on methamphetamines.
So do we know?
And that's a nasty drug.
It is, and do we know how it's being transmitted? I mean, is it through sexual contact?
Exactly. So someone's more likely in a primary, secondary stage of syphilis. They may have a sore in their private area, and they're having unprotected sex with the partner, and then it gets transmitted.
Oh, is it any other symptoms? I mean, is there anything else that we can?
It's interesting because really the symptoms of the adult, it's not. So if you have a drug issue, right? If you're using meth, okay, so you got a little sore maybe somewhere on your body. You may get a little rash on your palms and things like that. It's not enough to trigger someone to want to go get seen by the doctor. Especially, like I said, if they're using meth, which is a strong drug, that's not a priority to go get seen. It's not until there's a major issue, or it's not discovered till later when they're having a baby that has congenital syphilis.
How do we mitigate that? How do we counterfight this issue? Because look, from 1 to 45-50, that's a scary increase. And although 45-50 is a small number compared to our population in the county, it could be scary.
So we've sent out a lot of messages to our providers. Let's get more aggressive on screening women pretty much 3 times a pregnancy. When they first come in the middle of their pregnancy, and towards the end of their pregnancy. We're sending out posters, party cards in the areas that we've seen a lot of syphilis cases to try to get that education out there. We continue to get the message out there, but the sad part is recently we're starting to see people that we treated 4 months ago showing up again, needing to be treated again. So they're getting reinfected. See, once you get treated, it's not like it's a vaccine and they have lifelong protection.
Well, but what's interesting here is there is a treatment where it gets rid of it.
Gets rid of it, but then within a month, you could be vulnerable to get exposed to syphilis again.
So it keeps
So
coming
you
back.
may get treated, but 1 or 2 months later, if you're still doing unprotected sex with someone who's infected, you're going to get syphilis again.
This is a question off topic, but do you get surprised at when you tell people what the Department of Public Health does? That do they ever say, "Wow, I didn't realize that you all do all this stuff"?
No, they get surprised. But someone's got to do it. We try to remind them that's, sometimes they think, oh, what is this government program? But there's a lot of things we're doing to try to prevent disease. This is harming. Here you're having a kid born that may have lifelong problems. Remember we just talked about why do you care about me?
Yeah.
Well, that has an economic impact. This is a kid who's going to may struggle now when they get to school age and struggle learning because of the brain deformity they may have got when they had exposed to syphilis in utero.
It sounds like the agency's doing some important things out there to help the community. Let's talk about another thing, the black infant mortality issue. Fresno B has done some outstanding reports on it. It's been talked about out there. Can you tell us what's going on?
So this is one we've really struggled in the last 5 to 10 years, where we're seeing the African American infant mortality rate is much higher than the white or the Hispanic rate or the Asian rate. I mean, it's almost pretty much double when you look at rates, not actual numbers. We're talking about rates, and the rate is pretty much double. So the Black Infant Health Program was a great program that has a public health nurse that works closely with the pregnant mom, doing home visitation, and they've expanded recently, thankfully, to include health ed specialists who kind of work with the group of pregnant moms to create like a peer group so that they understand about the pregnancy and they could work with each other. So if one of their peers in the group is having an issue, they can help them through it. And it's been really great. We've had some great feedback from the members, and we're hoping that'll help with having a better delivery, healthy delivery. Hopefully it'll decrease the premature birth rate and hopefully decrease the infant mortality rate.
What is the reason? Do we know what's causing this?
There are a lot of theories. Some of the theories are, some of these women are coming from traumatic households, domestic violence, living in a neighborhood where there may be a lot of gang violence. When people don't realize if you're in a neighborhood where there's a lot of violence, it's hard to relax. That's going to raise your blood pressure. It's hard to get a good rest. I mean, you have in the back of your mind, oh my gosh, am I going to get hit by gunfire? Is something going to happen? That's a lot of stress on the body. So there's a lot of theories like that of, how do we help bring about a healthier environment in the neighborhood, in the home? How do we, once again, how's there access to healthy foods? Can they access healthy foods? Because diet is important, right? Making sure you're having good, healthy foods, not eating high-fat, high-caloric foods, right? We want to have a number of fruits and vegetables. And
Speaking of eating high-fat foods or eating different things, you're not saying don't eat fatty foods at all, right?
no, because believe me, you don't think I touch ice cream once in a while? I'm not. That says it's 0%. It's all about balance. You know what I mean? If you're eating well most of the time, if you're going to have an ice cream here and there, absolutely, and making sure you're exercising. No, of course having. I like pizza. I'm going to eat a piece of pizza. But once again, when I have that piece of pizza, I make sure I do my exercise too.
You mentioned something when we were talking about the black infant mortality, about public health nurses going into the household. What advice do you give your new nurses about that? Because it takes a special person to go into the household, do the job.
You have to remember, nurses, and once again, go back to a discussion we had in our first part of, when I see the nursing students from Fresno State talk, in the rotation, they're used to talking to a patient in a hospital room, in a clinic. It's kind of a sterile environment, right? Now you're going into their environment. And, some of those neighborhoods, you may not feel safe. They may feel uncomfortable because it's not their home. They feel like a stranger. So one of the critical skills, once again, is building that relationship with your patient, the trust, right? So that's why I go back to listening. It's important to listen, understand what the client or patient is going through, and then building up that I can't even say the word.
Camaraderie. I can't even say the word too. You got me on that one.
Camaraderie. Oh my God.
The audience knows what we're referring to.
How embarrassing. Sorry.
So let's talk a little bit about the public health department. You have services for children as well, right? Tell us about the services that you have for children.
So you're talking about so we don't have too many clinics. So some health departments have primary care clinics and many more health clinics than we do. We've had to significantly reduce those clinics because of the budget's cuts in the last 10 years. But we still have a immunization clinic. So
how does that work?
So anybody can go in, and mostly if they have Medi-Cal or no insurance, that's what that clinic is there for. That clinic is to be like a safety net if you can't get into a provider, if you don't have a provider. Now, in the last several years with the Affordable Care Act and all that, most kids have insurance now. I would say 98% should have insurance now. And so we always encourage you should begin your immunizations at the provider, right? Because you need to have that well baby, well child checkup. Okay, the immunization is just one component. There's a lot of other things that need to be done at the doctor's office. But sometimes families may have trouble getting to the doctor. Sometimes the pediatrician may not have the vaccine. So at least they can go to the health department and get those immunizations. But that does not substitute a visit to your doctor for your well child visit. I want to make that clear.
And then during flu season, do you offer flu shots as well?
We do have flu clinics. We have reduced those in the last 5 years. The pharmacies have done a great job offering flu vaccine, and so it's a lot easier to get flu vaccine throughout the community. But so we try to strategically put flu clinics so that people, if they're unable to get flu vaccine somewhere else from their own provider or pharmacy, then they can come in and get a low-cost flu vaccine. And if they can't pay for it either, I mean, we don't refuse services.
Tell us about birth certificates. I mean, people can go to the public health department.
Birth and death certificates are available at the health department.
So they go in and fill out a form and get that?
Yep. That's very easy, very simple. The birth and death certificates are available at the public health department. We also have a tuberculosis clinic.
Oh, interesting.
A lot of people think tuberculosis has been eliminated, but no, we still have several cases. Thankfully, it's a lot better than it used to be. 15 years ago, we'd have over 100 cases of tuberculosis. Now we average about 35 to 50 cases. But we got to make sure people are treated correctly, because if you're not treated correctly and you don't do well taking your medication, then you could sometimes, create a resistant tuberculosis organism that makes it much more difficult to treat. So it's a serious disease that we want to take care of.
Not much time left this week on the program, but last week when we were talking about the Zika virus. It's all over the media. I imagine it's still out there. Advice for people briefly to mitigate Zika.
Make sure you look around the house, inside the house, that you're not breeding mosquitoes. If there's standing water somewhere, make sure you don't have that standing water. If you feel you have a mosquito issue, or if you see a lot of mosquitoes in the neighborhood, contact your mosquito abatement district. They're there to help you. And make sure your screens, no holes in the screens, because these little buggers like to go through the screen if there's a little hole, and they're tiny.
And they go through the hole. They come
into your house. They like to bite those ankles. So be aware of your surroundings.
But there's sprays and stuff we can put on to keep them away.
There's sprays. Always use if you're going to be walking, exercise when you're doing your walks.
Yeah.
Mosquito repellent. Make sure you use it. It's safe. I know people used to be worried, but if you use the product safely, it's not an issue.
One thing that I noticed, the public health department has a website with a lot of information. If I go on your website, what are some stuff that I can find on there?
Yeah, go to fcdph.org. See, I remembered from part one. This week I remembered.
Part one, you struggled with that.
It took me a week to remember that. But there's several areas. There's descriptions of all the programs. There's, I really like our epidemiology section. So if you want to see the number of infectious diseases that are occurring in Fresno County, we have reports on that. We have reports on other chronic diseases, infant mortality rate. And it just has a lot. You can learn a lot. Oh, I forgot. There's also FresnoInspections.org if you want to see restaurant inspections. So
restaurants that I go to on a regular basis, I can find their inspection report.
Absolutely. I hope I said it right. FresnoInspections. I think it's FresnoHealthInspections.org. That'll be another one we'll send the right to.
When all else fails, Google.
Exactly. And I went on there recently. It's a great site. You really, if you want to know about a restaurant, how they've done on their health inspections, it's all there.
And it's one of the departments at the public health department that does that, correct?
That's right. That's our environmental health program. They go out there and they try to 2 to 3 times a year, maybe even up to 4 times a year now, they visit restaurants.
Interesting. You have a health officer. We have a few more minutes left on the program. You have a health officer. What's his role, and why should people go to his Facebook page?
So Dr. Ken Bird, great health officer. He's been with the county for several years. Has a lot of passion for improving the health of the public in Fresno County. He's been great. He's one of the rare health officers that has a Facebook page. So go to Your Health, sign up for that. He posts at least 1 to 2 times a day. Great information. Also look for, if you go on our website, you'll see links to his To Your Health articles. He's done stories on infant mortality. He's done stories on opioid abuse,
Which is another big thing.
He has articles on the lifespan of depending on where you live in Fresno County. Why do you have a shorter lifespan in this section of Fresno County compared to something else? Please take the time, read the articles, great stuff.
How can people contact you, or how can people learn more information?
So besides the website, you can call 600-3200 is our general line, and they'll be able to guide you, depending on what question you have, to the right place.
Thank you so much for coming on the program this week, and this is
Thank you
part
for having
2
me.
of a 2-part series. You provided some great information.
Great, thank you.
That's all for this edition of the Central Valley Ledger. I'm your host, Sevag Tateosian. This has been part 2 of a 2-part series with David Luchini, Assistant Director of the Fresno County Department of Public Health. Did I get that right?
Sounds good to me, man.
Thank you to the volunteer crew that made this production and every production possible. This week, we're at the CMAC Studios in downtown Fresno. We couldn't do this program without our volunteers. Thank you to our audience members listening to us on 90.7 FM, KFSR Fresno, and to those watching on Comcast 93 and AT&T 99. Hope you enjoyed the program. Hope this information was helpful to you. Tune in next week to a new edition.
KFSR and CMAC present the Central Valley Ledger every Sunday morning at 11:30. For a complete program schedule, visit kfsr.org.